skills recognition and legal aid, language and job matching support, training referrals, and psychosocial assistance. Services are delivered in person, online, and via hybrid models. Practitioners include career and legal advisors, social workers, intercultural mediators, and job center staff, all supporting personalized multilingual pathways. Germany's model is backed by national infrastructure and a wide stakeholder network. However, challenges include complex bureaucracy, high language barriers, and a lack of unified, co-located service centers in many areas. In Berlin, the Arrivo Program and Welcome Center serve TCNs, refugees, women, youth, and career changers. They provide tailored services including sector-specific counseling, legal and skills support, language and vet referrals, employer networking, and psychosocial aid. Arrivo combines in-person and online services, supported by multilingual intake and strong ties with employers. Specialized branches focus on sectors like healthcare and trades, with expert guidance on vocational pathways. A future go-to vet pilot in Germany could build on these systems by co-locating services for a unified client experience, enhancing digital case management and multilingual tools, deploying mobile outreach teams in rural and underserved areas, engaging employers, and vocation and education providers from day one. Spain offers several one-stop-shop models to support the career and social integration of third-country nationals. These are led by national ministries, regional governments, and NGOs, each addressing different stages of the migrant journey. Spain's PEAK program, coordinated by the Ministry of Education and regional bodies, allows migrants with work experience but no formal qualifications to gain official recognition of their skills. Services include career counseling and skills assessment, job matching and referral to vocational training. PEAK is a powerful gateway to employment and certification, particularly for TCNs in hospitality, care, or construction. However, it lacks direct language support, requires Spanish proficiency, and can be difficult to navigate without a valid ID number. Red Incola delivers a holistic OSS model for migrants, combining employment guidance with legal, psychosocial, and language support. Integration plans are tailored to each person, with partnerships linking migrants to businesses and training. With a multidisciplinary team and intercultural approach, Red Incola's model builds strong community trust. Still, it faces funding instability and limited capacity for expansion beyond its current regions. NGO AXEM offers integrated reception services for asylum seekers, migrant youth, and women. Its approach includes career counseling, language and legal support, housing assistance, and psychological care. AXEM excels at personalized, trust-based support. However, digital access remains a challenge in rural areas, and sustainability depends heavily on external funding sources. Spain's diverse OSS models show how legal status, skill validation, and personal guidance can be combined. For Go-To Vet, promising practices include tailored employment pathways, strong NGO public collaboration, embedding skills recognition into integration support. Sweden's one-stop-shop models for third-country nationals support integration through local municipal hubs, employment services, and targeted initiatives for both general and highly skilled migrants. Let's explore key examples across the country. In Gothenburg, the Municipal Integration Center offers in-person support for TCNs, including career counseling, skills assessment, job matching, and referrals. Multilingual staff and co-location of services make access easier. However, language barriers, limited digital skills, and weak private sector links remain challenges. Welcome House in Stockholm provides personalized employment counseling and family support early in the settlement process. Its hybrid delivery model boosts accessibility, but services are largely urban-focused and sometimes overwhelmed by demand. The Solna model, run by the Public Employment Service and local actors, features vocational coaching, language training and civic orientation, job matching, and internships. It's highly effective, over 70% of participants entered work or education. Still, coordination across agencies requires significant staff time and funding. In Lund, the International Citizen Hub targets skilled migrants and international families. It offers career re-entry programs, networking and job events, support for spouses and students. While impactful for professionals, it lacks structured language and job placement pathways for broader migrant groups. Municipal integration centers like JobTorg Stockholm and Malmö Integration Center support refugees and TCNs through career plans, skills assessment, language and legal guidance, internships, and vocational referrals. These centralized hubs combine employment, legal, and social services, but face long waiting times and varied employer engagement depending on location. Sweden's OSS models are locally anchored and centrally coordinated, multidisciplinary and multilingual, effective at providing early and tailored support. Despite strong frameworks, key gaps persist. Uneven coverage in rural areas. Limited employer partnerships. High staff demands in urban hubs. Fragmented services for less skilled TCNs. Go-to-vet pilots in Sweden can build on existing models by strengthening digital case coordination, scaling outreach beyond major cities, embedding VET partners into local OSS centers, enhancing employer links for mentorship and internships. Across Europe, one-stop-shop models for third-country nationals offer essential bridges to employment, education, and integration. While each country's model reflects its local context, common strengths and shared challenges emerge. All models provide a mix of career counseling, skills assessment, job matching, and legal or social support, often through multidisciplinary teams. The models all provide tailored services such as personalized guidance, individual integration plans, and sector-specific pathways which are widely used to meet the unique needs of refugees, women, youth, and skilled or low-skilled migrants. Most models combine in-person and online services, improving accessibility, especially in urban areas. The models require collaborative networks, coordination among municipalities, NGO, employment services, and training providers is a defining feature, helping to pool resources and expertise. Lastly, the models emphasize training recognition skills validation, professional accreditation, and referral to vocational or language training are core components in nearly every system. The models have shared limitations and gaps. Firstly, funding instability. Many OSS initiatives depend on short-term or project-based EU funding, risking continuity and scalability. There are digital language barriers. Access to services is often limited by migrants' digital literacy or language proficiency, especially among newly arrived TCNs. Fragmentation bureaucracy. Complex systems with multiple stakeholders can result in inconsistent service delivery and confusion for beneficiaries. OSS models have limited rural reach. Services are often concentrated in major cities, leaving rural areas underserved. In many cases, connections with the private sector, including internships, mentoring, and direct job placement, remain underdeveloped. The OSS models reviewed highlight promising practices in supporting migrant integration into the labor market. Strengthening coordination, digital tools, and employer involvement will be key to enhancing these systems and informing the next phase of Go-To-Vet one-stop-shop pilot development.